Managing diabetes on a budget relies on low-cost pantry staples, smart grocery shopping, and available healthcare subsidies. Low-cost, low GI staples. Prioritize affordable ingredients that digest slowly and prevent sharp blood sugar spikes, like legumes, beans, dried or canned lentils, chickpeas, black beans, soybeans, cowpeas, black-eyed peas, and kidney beans. Provide high fiber and complex carbohydrates for cents per serving. My choice is soybeans, cowpeas, black-eyed peas, and lentils with brown skin will have less than 20 grams per 100 grams dry weight. So they are okay for even keto diets. Whole grains, rolled oats, brown rice, barley, and whole wheat pasta are budget-friendly, high-fiber options compared to refined grains. Being a diabetic for more than 40 years, almost all of them raise my blood sugar. So I avoid them. Frozen canned dead vegetables. Frozen spinach, broccoli, green beans, and cauliflower retain full nutritional value, last longer, and prevent food waste. Affordable proteins include eggs, canned tuna or sardines, tofu, and bulk chicken thighs offer lean protein without high meat prices. If you go for animal foods, make sure to check your cholesterol regularly. With a little planning, you can build healthy meals around simple foods that are affordable and easy to find. The goal is to control your blood sugar while also protecting your wallet. One of the best places to start is your pantry. Foods such as oats, lentils, chickpeas, beans, brown rice, canned fish, canned vegetables, and whole grain foods can be useful, low-cost choices. These foods can provide fiber, protein, vitamins, and minerals without costing as much as many highly processed foods. Oats can be a simple and affordable breakfast option for many people with diabetes. You can add some nuts, seeds, cinnamon, or a small amount of fresh fruit for extra flavor and nutrition. But watch your portion size because oats still contain carbohydrate and can raise blood sugar. Beans and lentils are another budget-friendly choice. They provide fiber and plant protein, and they can replace some of the meat in soups, curries, stews, and other meals. Using beans to stretch a meal can reduce the cost while also making the meal more filling. Eggs can also be a relatively inexpensive source of protein. You can combine eggs with vegetables for breakfast, lunch, or a simple dinner. Adding vegetables can increase the volume and nutrition of the meal without adding a lot of carbohydrate. Frozen vegetables can be a smart choice when fresh vegetables are expensive. Research and guidance from Diabetes Australia indicate that frozen and canned vegetables can be useful alternatives to fresh vegetables. Choose canned vegetables with little or no added salt when possible. Buying vegetables that are in season can also reduce your grocery bill. You do not need to buy expensive vegetables just because they are advertised as superfoods. Cabbage, carrots, onions, spinach, pumpkin, tomatoes, broccoli, and frozen mixed vegetables can all fit into a healthy eating pattern. Fruit can also be included in a diabetes-friendly eating pattern. Whole fruit is generally a better choice than fruit juice because whole fruit contains fiber and is less concentrated in sugar. Choose fruits that are affordable and in season rather than buying expensive imported varieties. Another useful trick is to compare the price per kilogram rather than only looking at the package price. A larger package is not always cheaper if you will not use all of it before it expires. Buy the amount you can realistically use and freeze suitable foods when possible. Planning your meals before going shopping can save money. Look at what you already have at home and build your meals around those foods before buying more. This can reduce food waste and help stop impulse purchases. Try creating a few simple meals that use the same basic ingredients. For example, lentils can be used in soup, curry, or a vegetable dish during the same week. Chicken, eggs, beans, or canned fish can also be used in several different meals. Cooking at home can often cost less than buying takeaway food. It also gives you more control over portions, carbohydrates, added sugar, salt, and cooking methods. You do not need complicated recipes to eat well with diabetes. Be careful with foods marketed specifically for people with diabetes. Some diabetic labeled products can be expensive and are not necessarily healthier than ordinary foods. A simple meal made from vegetables, legumes, whole foods, and an appropriate protein source can often be a better value. Drinks are another place where you can save money. Water is inexpensive and is usually the best everyday drink for people with diabetes. Reducing soft drinks, sweetened drinks, and fruit juice can save money while also reducing added sugar. When shopping, you make a short list and try to stay with it. Supermarkets often place tempting foods where they are easy to see and buy. A planned shopping list can help you spend your money on foods that support your health. You can also compare different supermarket brands. Basic store brands can sometimes provide similar products at a lower price than well-known brands. Check the nutrition information and ingredients instead of assuming that the more expensive product is better. Another important part of saving money is making sure you use the healthcare support available to you. If you are in Australia, the National Diabetes Services Scheme, known as the NDSS, provides eligible people with diabetes access to subsidized diabetes products. Depending on your circumstances, this can include blood glucose testing strips, needles, syringes, insulin pump supplies, and some continuous glucose monitoring products. If you are registered with the NDSS, ask your pharmacy or diabetes health professional what products you are eligible to receive. Some people may also receive lower costs because of concession cards or other eligibility arrangements. Do not pay full price for diabetes supplies without checking whether a subsidy is available to you. Prescription costs are another area worth checking. In Australia, many medicines are subsidized through the Pharmaceutical Benefits Scheme, commonly called the PBS. From 1st January 2026, the maximum general PBS patient contribution for most PBS medicines is $25, while the concessional contribution is $7.70, although additional charges can sometimes apply. If you or your family use many PBS medicines, check whether you are getting close to the PBS safety net threshold. Once the relevant threshold is reached, eligible people can receive cheaper PBS medicines for the rest of the calendar year. Keeping track of your prescription spending can therefore make a difference. Healthcare visits can also become expensive if you always have to pay the full consultation fee. In Australia, some GP services can be bulk billed, depending on the doctor and your eligibility. Ask the clinic about bulk billing before making an appointment so you know what you may have to pay. Do not skip important diabetes appointments simply because you are worried about the cost. Ask your doctor, diabetes educator, pharmacist, or clinic about lower cost options and available support. Getting help early can be much less expensive than dealing with preventable diabetes complications later. You can also ask your pharmacist whether there is a lower cost option for a medicine when appropriate. Do not change brands, doses, or stop a diabetes medicine by yourself. Your doctor or pharmacist can tell you whether a different option is suitable for you. A budget-friendly diabetes meal does not have to be boring. Try simple combinations, such as lentils with vegetables, eggs with whole grain toast and vegetables, or canned fish with salad and a suitable carbohydrate portion. The right portion sizes are just as important as the food choices. It is also helpful to think about carbohydrate portions. Foods such as rice, bread, pasta, potatoes, oats, beans, lentils, and fruit can all contain carbohydrate. The amount that works best for you depends on your health, medication, activity level, and individual blood glucose response. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Tell me in your comments, what foods out of the list are your favorites? Another way to save money is to avoid wasting food. Use vegetables that are starting to soften in soups, omelets, curries, or casseroles instead of throwing them away. Freeze suitable foods before they spoil and plan meals around what you already have. You can also cook larger portions and save some for another meal. This can be especially useful when cooking foods such as vegetable soup, lentil curry, bean dishes, or casseroles. Having a healthy meal ready at home can make it easier to avoid expensive takeaway food. But do not feel that you have to follow an extremely restrictive diet to manage diabetes. Diabetes Australia recommends a healthy eating pattern based on a variety of vegetables, legumes, fruit, whole grain foods, lean proteins, and suitable dairy or alternatives. The best eating pattern is one that is healthy, affordable, practical, and realistic for you. Small savings can add up over the course of a year. Saving a few dollars on groceries, prescriptions, testing supplies, and healthcare visits can make diabetes management more affordable. At the same time, choosing nutritious foods can support better overall health. Managing diabetes on a budget is really about making smart choices rather than buying expensive products. Use simple pantry staples, buy seasonal and frozen vegetables, plan your meals, reduce food waste, and compare prices. Most importantly, check what healthcare subsidies in diabetes support programs you may qualify for. Your health should not depend on how much money you have to spend on food. With careful planning, many healthy diabetes-friendly meals can be made from ordinary foods that are already available in your local supermarket. A simple approach can help you protect both your health and your budget. This video is for information purpose only. Talk to your personal doctor before any health-related change. Yaksa.